Spectrum Broker, we provide everything from benefits, wellness, HR solutions, to compliance and payroll. Today, we're going to be going over innovation in healthcare, and we have Remedy here to help us with that. They're one of our partners and definitely benefits experts. We have Mark Riddick on the line with us today, and he's going to be sharing a lot of really valuable information with you guys. And some new and exciting tools and technology and showing you a little bit about how it all works. Just a couple important reminders as you guys enter the room. Please go ahead and put your phones on mute so we can eliminate some of that unwanted background noise. If you have any questions, go ahead and type those into the chat box and we will answer all of those at the end. I do want to remind everybody that we will be sending out a follow-up email today with a recording of the webinar and some more valuable information. So Mark, I'm going to go ahead and turn it over to you.
Thanks, Marcelo. Welcome, everybody. Thanks for choosing to join us today. We do respect your time and appreciate you investing some of it with us, and we want to make sure this is worthwhile for you. I'd also like to thank Phazon Group, first for hosting the event, and second for all their innovation and the approach that they take, which has enabled us to come together today and is helping their clients on a day-to-day basis in the trenches of healthcare. I'm going to start off with, let's go here. This first slide, which gives you a little feel for some of what happens when we start talking about innovation. We've all proposed innovative ideas during our careers, and some of us have actually run into this kind of a response. It's kind of mind-boggling, right? People just don't seem to understand sometimes that innovation is necessary, and it's tough to get out of a rut. I get that, especially if they think that they're taking too much of a risk. The good news today is that everything we're going to go over is already being done, and it's being done successfully. The innovation involved is what we're attacking and how we're leveraging those working pieces to eliminate barriers and maximize the success that can be had. Let's frame the presentation a bit for you. My background is in healthcare consulting. I've done that for over 25 years. So I'm pretty familiar with the challenges you face every day and year after year. I shifted out of the consulting role with the goal of trying to break that cycle of frustration and poor compromises every year. We believe we've developed an answer to that. Of course, you can decide for yourself if you agree, but we're going to lay that out for you and give you all the tools you need to assess what we're up to and how it might fit for you. We are here today because we need to change things. They're not going to change on their own. We know that. There's been very little positive change for quite a while now in the healthcare arena. And most employers have been paying more and getting less for a number of years now. So that's no new news. To change things, we need to innovate. In our case, we want to address a couple of core issues that really have eluded us so far. The two that we're targeting are the cost of care and what we like to call the healthcare user interface. We'll define both and what challenges they present, some of which are pretty difficult and have been pretty persistent. After that, we'll take a look at the Remedy platform as an innovative way to help overcome those challenges so we can attack the cost of care and overhaul that user interface and make it work better. From there, we'll drill down into the specifics of Remedy, what it's made up of and how it operates. And then we'll get into the details of how you can benefit, what are the opportunities financially for your planning and for your bottom line, and how you can maximize that. We should be through the deck in about 30 minutes. After that, we'll have a Q&A session, so I hope you'll be able to stick around and share your questions. Finally, I would ask that as we move along, you keep in mind the three words you see at the bottom of the slide: simple, human, and empowering. These are the elements we're really trying to restore to healthcare, and they're also at the heart of everything that we do at Remedy. So these questions that you've probably thought through numerous times in your frustrating moments of dealing with healthcare are rhetorical, but that's the point. We all know that no one is getting anything more for that renewal increase every year, and most of the time we're having to cut benefits just to make the increase manageable for your budget. Unfortunately, also it hasn't been that long since some folks' cost was half of what it is today. It's doubled pretty quickly in a lot of cases. And we all know that the benefits haven't improved as that cost has gone up. Seems like a long time ago that we were able to manage our benefits and costs fairly well, but we've been taking hits year after year for quite a while now. And the fact is that we can't keep doing it. Healthcare is a top 3 expense for most companies. It has been for quite some time. In fact, it was back in 2005 that Starbucks announced that it had crossed the line and was now paying more for healthcare than coffee. And in 2007, GM had to do the same thing and announce its healthcare costs that exceeded what they paid for steel. Not that long back, but quite a while when you think about the increases that we've had since then. The silver lining, I guess, if you have to try to find one, is that most of what's being spent on healthcare is still going toward medical care costs, not necessarily all of the other elements that we sometimes get focused on. So at least we know where we should put our focus. The bad news is that it's almost impossible to effectively reduce rocketing medical care costs. The question, of course, is why? Well, we all know about the lack of transparency. That's front and center. And it's really the primary reason that it's impossible to attack the cost of medical care for most companies and most individuals. So without transparency, things kind of cascade. It's easy to see why, when you see those instances of overcharging that come up to light periodically, that we haven't had any success in establishing or enforcing accountability on pricing. Can't do it if you can't see it. Now, not all providers overcharge, but those who do are all over the board in how far they go. So there's also a huge variance from that overcharging in what the cost of care is for the same services in the same town and even in the same network. So that's why the cost of care is a mystery in provider networks. Now, most employer health plans do rely primarily on network discounts, as you all know, and that's supposed to help keep medical care costs down. But we also know that that hasn't worked. Network discounts haven't been able to keep your plan costs from rising rapidly over the years. Some probably know this, but maybe some don't. That's because the discounts really are a percentage of medical charges, not actual discounted prices. And so unless you know the actual charges and whether they're fair or not, they're kind of meaningless. The actual medical charges are set at the discretion of the providers. So even with an impressive sounding discount from your network of maybe 40 or 50%, you're overpaying if the charges are 4 or 5 times what they should be. And they often are, we just don't get to see it. So these factors are combined to make it nearly impossible to be a smart consumer within our healthcare system. Which leads us into the challenges faced by the users of the system, so our employees and their family members. Is it any wonder that people throw up their hands in the system and just give up? It is incomprehensible, and it is an unfair system when you look at how it's tilted. Keep in mind, we spent the last few decades using plan designs that kept the end user from knowing or caring much about the cost of medical care or how it all worked. We insulated them. Copays and hands-free claims filing really left those frontline folks without a clue. We like to call that the knowledge gap, and it's big. Make matters worse, healthcare is getting more and more complicated as we go along. That's not new news either, but it's also becoming more of a do-it-yourself situation as consumer-driven healthcare and high-deductible plans have come into vogue and really overhauled the landscape. So the question is, what do we need? Well, most cost of care efforts have been top-down and somewhat retrospective. Utilization review, large case management, chronic conditions, a lot of good programs that are being handled typically at the TPA administrative level on a top-down basis. But every claim really starts with a person, obviously. So that's where we felt you needed to catch them and be proactive about it. If you go bottom up, you can attack the cost of care at the member level. We also need a solution that enables us to blanket the spectrum of care, everything from routine to catastrophic. That way, the variable nature of your claims doesn't matter from one year to the next. You're able to reduce claims costs regardless of the claims experience you have. That's a biggie because, as you'll see in a little bit here, we have a tendency to look backwards and fall into a trap that we like to call chasing the past. Now, I don't believe our people are going to catch up on the healthcare knowledge gap because it is so big and it's growing too fast. And we don't really want that to become their full-time job, right? I mean, that's not what they're there to do every day. So that means we have to give them expert help in order to get things done in the healthcare system. But throwing a mixed bag of different solutions at people won't work. It's overwhelming and it's an administrative nightmare and it won't get used, so it's bound to fail. And the reason I know that is I have done it. I've set up an array of individual pieces trying to solve this problem with clients, only to have it fall apart because of the complexity that it creates. So everything that we leverage has to be integrated into one delivery system, something that's always at hand, it's easy to access, and it's simple to use. So those are the design specs here on this screen of what would make for a highly effective healthcare cost savings platform in our estimation, and that's what we believe we've built in Remedy. We are going the wrong direction. All right, so Remedy, it's the first healthcare app of its kind, and we're going to get into what that really means. We refer to it as a full spectrum connectivity app. We contracted with the best proven cost and time saving services in the marketplace and combined them to create Remedy. Full spectrum means the ability to impact claims everywhere from routine to catastrophic and do that all in one place. So whether it's telemedicine, talk to a doc as you see there, or surgery assist, help with a catastrophic surgical procedure, it's all in one place. Connectivity means more than just providing an information resource, which is pretty common these days with healthcare technology, is a lot of information being thrown at people, which obviously depends on them knowing what they're doing to use it. So instead of just providing an information resource, we're providing a fast, direct link to live expert help and putting that right at the user's fingertips. Simply put, Remedy removes the barriers and bridges the gap to make healthcare a less onerous and more appreciated process. It's a simple, human, empowering innovation. Here are a list of services that have been successful for a number of years in the marketplace and that we've included in the Remedy app. So we'll take a look at each of these individually right now so you get an understanding of how they all fit together. Telemedicine is the most widespread and recognizable. Obviously, folks out there have seen and heard a lot about it. The media and also the industry is pushing this along at a pretty good clip. And being able to talk with a licensed, board-certified medical professional 24/7 is pretty convenient, and it improves productivity by cutting down on lost time. It also eliminates the office visit charge that comes with an office visit and goes to your claims fund. Now, most often telemedicine is being sold today with a fee that the member pays when they use it. And that's done because it brings down the employer cost on the per employee per month basis. So it's an easier sell. But that approach ignores the fact that any consult fee pretty much dooms the program to single-digit utilization, just because, hey, if I'm going to have to pay something at time of use, I'll just go see my doctor and pay my copay. When you remove the consult fee barrier, utilization jumps to over 20% from single digits. So it's a matter of saving pennies or saving dollars. Since we believe in saving dollars, we didn't build any member cost into the telemedicine service within Remedy. Price transparency is mentioned earlier. Somebody mute their phone, please. Whoever has that, there's a lot of background noise coming through.
Yeah,
Thank you.
trying to mute everybody as they come in. I'm muted pretty much everybody it allows me to. So
Okay.
please go ahead and
I just
mute
didn't know.
your phones as you come into the room.
Great. Yeah, I was just, the sirens weren't too bad, but that last sound sequence was a little distracting. So from price transparency standpoint, we all know that it's very confusing. It's hard to get information, and it varies greatly within even a provider network. Now, luckily, there are a growing number of transparency solutions and tools out there. However, a lot of them are informational based. So they provide a lot of information, but the member still has to know what to do and then go do it themselves if they're going to have any success. And that just doesn't happen. Because they don't know what to do and they don't know how to do it, it's really not a good place to do it yourself as a solution. So in our opinion, it's imperative that transparency is at least a guided process. Ideally, it's one where an expert can take the lead and then get back with you and educate you. And that's what we've included in Remedy, is the expert taking the forefront and getting things done for the member. Specialty networks, as the large PPO networks, their ineffectiveness and kind of the whole smoke and mirrors of discounts versus actual charges is becoming more apparent. We're seeing more specialty networks step in and have an impact. They do that by focusing on a single type of care and then finding providers willing to contract with them and work with them. All the providers in a specialty network will agree to pre-negotiated charges for their services, and you get to know what the charges are right from the start. The prices are significantly less than an in-network charge after the PPO discount. So you get both the savings and transparency. What that means is the surprise $4,800 MRI bill doesn't happen. And as you can see here, the average savings from an imaging specialty network, which is one we've included with Remedy, is $650 per MRI. Advocacy. This is a great kind of core service because of all the different things that can be done here. Employees wrestling with things on their own can spend countless hours trying to figure out the documents that they get in the mail, their EOBs, their bills, claims issues. And guess what? They can't really do that after hours because the people they need to talk with are only available during business hours. So that means that they're doing it at work. Not great. That lost productivity is what I like to call the invisible healthcare cost. Of course, they can always go to HR and ask for help, but that's just shifting the productivity loss to the HR department and adding HIPAA concerns as they expose more of their personal health information inside your walls. So doesn't it make sense to direct them to somebody, a live advocate who can take care of it for them so they can get back to work? That's exactly what advocacy can do. It's whether it's an issue of coverage, benefits, deductible levels, care options, unwinding a bill, advocates can do it and then explain it. So it's a huge time and headache saver. At the same time, it's a great education for the member. Many HR professionals today are finding advocacy programs provide a great service to their employees while increasing their privacy protection and also reducing the company's HIPAA exposure. Plus, it frees up HR to be proactive in other areas, so they don't necessarily have to spend hours and hours doing the things they've had to do in the past, tracking down claims information and EOB problems. They can put that into other things. Surgery assistance programs are an outgrowth of international medical tourism, and it's really come as an answer to Americans not wanting to get their medical care in other countries. They've grown to include helping patients find non-surgical treatment alternatives, which is great. And they can even help determine if a procedure is necessary or not. And given that 30 to 60% of surgeries are avoidable or unnecessary, opportunity here. Avoiding surgery is both a huge psychological and a huge financial win. And when surgery is necessary, they identify the best place to have it from centers of excellence around the U.S. where they pre-negotiated the pricing. so they can coordinate care with the best providers in the country with the best outcomes, but at a much lower cost, 30 to 50% lower even when you include the travel and lodging costs. So those are pieces, and these are the issues then that we feel we've solved by pulling these things together and building the Remedy app. One of the most entrenched issues I referred to earlier is called chasing the past. And that is, we look at last year's claims. For those of you who've been through multiple renewals, this will sound very familiar. And I've done this and did this for years. We look at the claims to see where we might have problems. And for example, if we had a lot of ER visits that weren't really emergencies, it looks like a smart move to install a telemedicine solution. However, at the end of the following year, we'll look at the claims again. And that's when we see that we had a spike in MRIs, but not much in the way of ER visits, or telemedicine use. So the telemedicine program is then viewed potentially as an unnecessary expense, and sometimes it just gets tossed out the door. Then, based on the MRI spike, an imaging specialty network might be installed. So we get into this cycle where you're chasing past experience and never able to catch up. Been there, done that. Might sound familiar to a number of you here. Since claims experience is always variable, the only way to ensure you hit the mark consistently is to build a solution that covers the entire range of care from routine to catastrophic, as we've talked about, and Remedy does that. That said, if you just try to do a patchwork job and put a bunch of individual solutions into play, that's not going to work either. There are too many things for members to remember. Which service does what, how do I access them, plus the administration and implementation are nightmares. Building Remedy as a mobile app solved that issue. We've already touched on how a consult fee at time of use really undermines telemedicine utilization and the resulting savings. With Remedy, there's no consult fee or copay to use any of the services, and use is unlimited for employees and their dependents. So we wanted to do everything we could to remove barriers to utilization. Another pitfall to avoid is that do-it-yourself proposition because people don't speak healthcare, and connectivity to live experts is our answer. So combining the right solutions in the right way is how Remedy changes the way we interact with healthcare, making any healthcare event a savings opportunity. We think that's a great step in the right direction. We also have done away with jargon and created a clean user interface that connects to live help in just 2 taps. So the experience is more positive, it's less daunting, and it's less costly. $1.2 billion in savings in just the last year is what our partners on aggregate achieved. And that's pretty impressive as a 1-year savings number. But what's even more exciting is that they have been able to have that level of success while they've all been operating independently and trying to figure out how to overcome their own utilization issues. The Remedy app solves those issues so that success can be maximized. With Remedy, we've created a whole that's greater than the sum of the parts. So there's no more chasing your claims history, trying to make your people healthcare experts, reminding them that they have a fridge magnet or a key fob or an ID card with various websites or phone numbers on them. Everything they need is at their fingertips. So what can you expect to save using Remedy? That's the bottom line, right? Well, here's some averages that give you an idea on a service-by-service basis. Numbers will vary, of course. If you're in a high-cost area, talk to a doc savings may be $250 instead of $150, depending on what an office visit costs. If you're in a lower-cost area, it could be $100. And many of you have probably concluded by looking at the access fee on the slide that it doesn't take much to drive savings using Remedy, and you're right. We've been able to get preferred pricing from our partners so we can make all the services available to an employee and their dependents on an unlimited basis for $15 a month max. And you'll understand a little bit here when I say max, that means we do have some flexibilities based on services, and that does affect the cost. So we'll talk a little bit about swapping in services you may already have, which of course would then reduce the costs. Most annual renewal increases that we've been seeing are 3 or 4 times that PEPM $15 max. We know that that doesn't get you anything, and it's certainly not going to get you savings or employee appreciation when you have that renewal increase. So on a relative basis, it's a huge step in the right direction. Plus, your plan members, again, remember, are paying nothing to use any of the services, no consult fees or copays. So that means they'll use the services more, and you'll get greater savings in the process. So this is how it looks from a group level. If you have 1,000 employees and 10% utilization, and those are, the 10% is a conservative utilization rate, and we've also been conservative in taking any catastrophic surgeries out of the equation because those can swing things dramatically. We don't want to tilt the picture with outlier claims, but there's still an impressive net savings. So the question really is, how would this look for you? And we can show you that using your claims data, your factors, and your assumptions, if you like, to take a look at that, because these are based on our partners' data as well as national averages for utilization, and then some of our own assumptions like the utilization rate of 10% for the app and taking the catastrophic surgeries out. So if you'd like to see that calculated to your situation, we can certainly do that. Let's take a look forward. So over the next 3 years, what does this look like for that same company? Again, assumptions are relatively conservative, especially some of you might laugh at the $600 current monthly employee cost, but what we wanted to do is keep things on a very realistic level. We know that doesn't cover anywhere near what your average would be when you start to take into consideration family members as well, and geographic areas. In fact, where I sit here in Colorado, in the mountains, we were talking last night, and one of my friends told me that they just saw single rates in our area go to $1,800 a month. We are, by the way, if not we've been the highest cost county in the country, and we may still be there based on that number. So if you look at this, it really changes your thinking a little bit about going down the same path. Obviously, everybody wants to make a change, and this just shows you the cost of staying as we are, status quo, versus trying to attack the cost of care, which of course has been difficult to do. But I count a $2.8 million swing over 3 years as a win, especially in a situation where we've been going backwards year after year. Utilization, of course, is the key to all this, and to be successful, you need to drive utilization. And we've made that a lot more likely already, just by putting all the services together and then putting them in an app format where they're always within reach. So that's a great start point. And instead of employees trying to drink from that fire hydrant of info that comes at them at open enrollment meetings and trying to remember what to do months later, we really simplified the message they need to get down to use Remedy. Because once they're there, it's very intuitive and very simple in terms of the user interface, and they're going to get the live help they need immediately after they hit that second tap. We also provide clients with best practices that we've established, both in implementation and on an ongoing basis as we develop new ones. So we're constantly looking at how we can improve utilization on an ongoing basis. We also want to make sure that people remember Remedy when they need it. So providing some gentle reminders helps a lot. So we do that every 2 weeks in the form of pop-up notifications and email reminders. So instead of them hearing about things at open enrollment and then maybe periodically throughout the year, they're actually being nudged every couple of weeks. So, the odds of them not remembering Remedy when they have a healthcare concern, whether it's a care issue or an administrative issue, goes way, way down. Now, all that sounds great, but we also know that nothing is going to work as well as it could possibly work unless leadership is backing it on an ongoing basis. We make it as easy as possible to do that, but there do need to be some expectations set and some promotion along the way, which of course we do support. The level of employee engagement question is always a good one. I don't usually hear anybody answer that lower than, say, 80 or 85%. Realistically, what you're saying is, do you expect your employees to do what you're asking them to do? And I don't think anybody's ever answered that question yes, but just 10 or 20% of the time. And that's really what we're shooting for right out of the gate, is a conservative utilization in that 10 to 20% range. Also, keep in mind you're asking them to use something that's going to make their life easier, save them time, save them money, and also save them frustration. So it's not an uphill battle like it can be when you're asking people to make lifestyle changes and stop eating fast food. That one's a noble cause, but not one that we are engaged in. There's plenty of folks working on that one. From a competitive advantage standpoint, there are some companies out there that are putting together some similar cost-saving services, maybe 2 or 3, I think is the most we've seen in any one. But they really don't have an underlying strategy about the whole cost of care and the spectrum of care. So you've got some pretty good gaps in there. And then what we've also seen is that they're pretty tech-heavy. And because of that, instead of relying on people, they're relying on information. And so their pricing is pretty high, typically about twice that of what we have going with Remedy. So they're providing really about half as much for twice the price. Just to give you a sense of what's out there, we're still pretty far ahead of the marketplace. Now, if you can make healthcare less costly and more positive for your employees, that's clearly going to put you in a more competitive situation hiring and retaining talent. And then improving productivity and reducing expenses on your end is going to make you more financially competitive as well. So the nuts and the bolts. Like the app design itself, the logistics are clean and simple, principles that we try to adhere to. And because of that, Remedy can be implemented any time of the year. You don't have to wait for a renewal to start using it and saving time and saving money. We can implement any first of the month. Now, that's really because we don't have any disruption in what we do when we do implement. And this is a point that I think needs to be made very clear. We're not changing any plan designs. We're not changing any of your current administration. We're not changing any of the benefits. In fact, if you have a similar service already in place, for example, telemedicine is very prevalent, we can swap that service that you already have in for ours on the app. So rather than forcing you to disconnect something that you already have and like, we'll actually enhance its utilization by wrapping around it and including it on our platform. We felt that was important because we want to be zero disruption to our clients. Also, since Remedy is attached to you, it's not attached to a carrier, a TPA, or any outside source. When you need to make a change, you can make that change, whether it's the TPA change or stop loss or network or carrier. Having Remedy isn't going to become something that can be used as leverage to keep you someplace you don't want to be. We felt that was important because a lot of healthcare vendors today are trying to create dependencies so it's difficult to leave. It's truly a market share game. There's not a whole lot of new green fields for vendors to go out and get. It's trading. It's a zero-sum proposition. As far as enrollment goes, all we need is a census, some plan information, and a couple of signatures, and we're good. Billing, we've simplified that down to a self-billing process. And from a reporting standpoint, availability and frequency of reporting is really determined just by the group size and the services that we provide versus the services you may already have. So I wanted to say thanks for joining us today and continuing to look for innovative solutions to your healthcare challenges. We believe Remedy is a really good one that you should take a close look at and consider. Hopefully this has been helpful and educational for you. By being here today, you're obviously proactive and open-minded, And since we're in the innovation business, we appreciate those qualities a lot and appreciate the time you've taken with us. To express our gratitude, we'd like to offer the opportunities you see here for some discounted pricing to everyone on the call today who chooses to implement Remedy here in the upcoming first quarter of 2018. And what's next? Well, we hope you can stick around for the Q&A session that's coming up. And if you'd like to see if Remedy might be a fit for your particular situation, just type connect in the chat box, and then we will get in touch with you within the next couple of days and answer any questions you might have. And obviously, if you'd like us to take a closer look at analysis, a savings analysis like the case that we put up on the screen here a little while ago, we can do that for you as well. Thanks again for your time. Marcelo, I guess we can jump right into the Q&A.
Yeah, thank you for such a great presentation there. If anybody has any questions, now would be the time to type them into the chat box. We did have a few questions come up. Here's the first one. So the services are all existing services that have been working, and Remedy is an app that consolidates them all into one place. Is that right?
Yeah, that's a very good summation of it. The idea isn't to create something new that's complicated and difficult because we've already got that. What we wanted to do is take what we know already works and then create something that's simple, easy, and is even more effective. So yes, you've got it. That's a good way to put it.
All right, great. And we have another question. Is this in addition to our current healthcare?
Yes, it is. We are I guess you could say, a bolt-on. Part of our design is to be able to work with existing healthcare plans. I will make one clarification for you. Obviously, the savings that go to the claims fund is assuming that you're self-funded in your planning. That would not be the case if you were fully insured in your planning. That would be then savings that would go to your claims experience, and then the carrier would factor those into your next renewal. So the opportunity exists to impact your renewal through your claims experience using Remedy fully insured, and to just go right to the bottom line if you're self-funded. And we have had situations where fully insured groups whose claims experience hasn't been very good have leveraged Remedy and got to a point where they could go into the self-funded arena. So hopefully that answers that question. We are a non-disruptive add-on to your existing planning.
All right, thanks for clarifying that. And does every employee have to participate?
Great question. We do have a philosophy, and once you look at numbers, it makes a lot more sense in your own situation. But if you start doing anything but everyone on the health plan, so I would suggest strongly that everyone enrolled in your health plan should be provided with the Remedy platform, because then you're going to capture the most activity, the most claims activity, and generate the most savings. As you start to carve that down, you do reduce the opportunity to have a good impact. That said, we also have done with some clients, and especially depending on their geographic locations and their total size, we have done some pilots initially and then expanded. So we're a flexible organization that looks to work with you. We do recommend, though, that the ultimate goal is to have everybody on your health plan on the Remedy platform so that you can maximize the results.
Okay, great. And I believe you touched upon this, but just to 100% clarify, will Remedy replace an insurance plan?
No, Remedy is not to replace an insurance plan. Remedy is to help people using healthcare save money, both at the user level. So, for example, if you use the telemedicine service and you don't have to come out of pocket for a copay, then you're saving money at the user level, and the plan doesn't have to pay out that office visit charge. but we are really here to improve the performance of a health plan, not replace a health plan. So really the areas that we want to focus on are those cost of care issues and making it a better experience. Then the plan runs more efficiently and effectively.
Okay. And how well does this work for a small employer with less than 20 employees?
Great question. We have one service that is not going to work well below 150 employees because of the logistics and how it needs to be set up in the background, something that we do. But with a fully insured situation, that's going to always be the case. If you do have a small group, so the surgical assistance program is what I was referring to. And that one we have to remove when we're talking about smaller groups or fully insured. Other than that, everything else can apply. It's just a matter of, what is your plan design look like, and what's it going to mean to you? You have to keep in mind as well that the smaller you are, the fewer claims incidents you have. So we have a proportional impact, I guess you could say.
Okay. And we have another question here. If someone already has telemedicine, is that a problem?
No, not at all. We know that that's very common out there. And if you like the program you have, if you have a telemedicine provider that you've been working with for a while and your people are used to it and everybody's comfortable with it, then we don't want to disrupt that. So what we would do is unplug our telemedicine and program the connectivity to direct to your telemedicine program, so that essentially we could wrap around it, include it on the app platform, and make it perform better for you. Of course, we'd also reduce the cost basis because we no longer have to pay our service provider on the telemedicine services.
Okay, great. And can someone sign up for the app if they're not on their current health plan? So I guess if they have a different health plan.
Yeah, very good question. We can do that. It is Remedy is an employer-paid program, so the employer would have to decide if they want to make it available to folks that are not enrolled on their own health plan. If they want to do that, yes, we can do that. At this point, it is an employer decision. Down the road, we are hoping to move to also have a direct-to-consumer offering. There are just some logistics to that are a little more difficult, so we haven't rolled that out yet.
Okay, so currently the cost cannot be passed on to the employee. It needs to be employer paid, correct?
Yes, if it is paid by the employer, then it is a universal enrollment, which we can do on a census basis, and that's really what we're trying to do. If we take it to a shared or a voluntary, it changes the dynamics in a way that undermines the effectiveness of the program. So we've, at this point, kept it at a employer-sponsored.
Okay, thank you for clarifying that. That seems to be all the questions we have right now. If anybody would like us to get in touch with you, please go ahead and type connect into the chat box, and we can have a more personalized conversation. I do want to remind everybody that they will be receiving a follow-up from us, Phasing Group, with a recording of the webinar. And I want to thank Mark and Remedy for doing such a great job presenting today.
Thanks, Marcel. Appreciate it. And thanks, everyone, for your time and all the great questions. We are more than happy to delve into this further with you. Just as Marcel was saying, let us know by putting connect in the chat box, and then we can walk through this with you, and you can determine for yourself whether Remedy is a fit for your situation.
Great. Thank you very much. We hope everybody has a great rest of their day.
Thanks. Take care, everybody.